this is my favourite time of year, actually. And the reason it's my favourite time of year is because the Tour de France is coming up. And the Tour de France is my favourite sporting event. And the reason it's my favourite sporting event is because I've spent the last 20 years as somebody who looks at organisations, either leading them or helping them change and transform over a period of time. And the whole race of the Tour de France is a fantastic study in a complex adaptive system. So if you watch the race on the road and watch the way it adapts and the way the teams adapt, create an arrowhead, go after the lone stroke, change and work collaboratively together as the race goes on, you'll see a really fascinating complex adaptive system in motion. And what's really interesting is that when you get the collaboration wrong and you use it for nefarious reasons, like Mr. Armstrong, yeah, how you can go completely off course once you get the collaboration wrong. You get somebody in there not playing to the rules and wanting to be a bully boy, basically. So it's really fascinating, and all the stories around the tour, just one of the most interesting organisational subjects you can look at. And if you really want to look at complex adaptive systems, look at a book called Surfing on the Edge of Chaos, because you get real change. A guy called Richard Pascal, I don't know if anybody's read it, about treating a business as a living organism and how you would change that. And you get cancers in living organisms, you get cancers in business, and how you work that. So I'd encourage you to look at that, or anything around the innovations dilemma, which I'll touch on a little bit, and especially one being written around for medicine as well. So have a look at those. And about 5 years ago, in this time when I was looking at these organisations, I started looking at organisations at a country level, at a macro system level. And this came about because us as a company, we have our European headquarters in Southern Ireland. Tax reasons, as everybody does, yeah? So maybe if you're setting up businesses, you know, anyway, I'll talk to you about tax allowances outside of this room. But it's an interesting thing if you want an AHSN. If you really, I've never seen any of them yet have driving tax allowances and things. Somebody needs to seriously look at that aspect. I got interviewed yesterday, and they said, by the press, said, what one good thing could the government do for us? I said, well, they actually start to look at things like tax allowances and zoning. Ireland are very good at zoning, and they'll out-zone you to do what you want to do. They're looking at embassy zones at the moment, where the laws of your country applies in the data centre. Now, if Scotland get annexed, yeah, so he's just going to say 1% tax here for all business, yeah? It's going to put, you know, that's what I would do if I happened to me. Anyway, we're off on a tangent there on that one. So anyway, about 5 years ago, I started looking at systems. I had to go to Ireland because the Irish had given the 2 fingers to the European Union Collaborative and said, we don't want to be part of it anymore. And my business said, they're absolutely crazy. You need to go over there and have a look at trying to get them, you know. And we had a little leeway because a technicality come up that we could actually have a revote. And they said, how do you go over there and change a system and help change a system at a government level that will actually say, this is really, really bad if you don't work in this collaborative? And obviously the bailout and things subsequently happened there. And then about 3 years ago, I got involved in this thing, wealth creation at a macro system level. And it first came to my attention working with 2 people. One guy was a guy then called Commodore Mellett. He's now the Admiral of the Fleet, Admiral Mark Mellett of the Irish Navy. And Ireland, unless I don't know if you're aware, is now the 3rd largest sovereign country in Europe. So what Ireland did is said, how do we make wealth? How do we create money? How do we as a public body, this is what they said to everybody, go and create wealth? And they said, well, we're great at farming, so we're going to declare our area that we farm is larger than it has been. And they declared massive amounts of the Atlantic Ocean as now that they own it. And so now they're going to step into that and say, how do we farm that? And how do we farm it for wind, wave energy? And they've already built an energy bridge from the UK to Ireland. It doesn't to England. It doesn't touch the Irish grid, where they're going to be the biggest exporters of renewable energy, because everybody's moving to cities. The big dominant city of Europe is going to be London, and the thing is, how do you feed that city, whether it be for food, energy, or whatever? So they've played their plan and said, we are going to create wealth. And Mark, who was the head of the Navy at that point, he's now head of the Defence Forces, said, absolutely, how do I play? How do you have my ships, how do you have my Navy at your disposal to do that? And they created an energy cluster in Cork called IMERC. And subsequent to that, they're now writing their second white paper in defence. And very much like an AHSN, they're looking at the uniques Ireland have around defence, around some of its status. And I've been helping them write the second white paper in defence. That then led on to conversation I then had in the north of Ireland with Minister Poots. And he was the first person I met who's the Northern Ireland Minister for Health, who put this idea of, you are going to be a wealth creation body. No longer are you going to be a cost centre, yeah, and fix patients. You're going to be an investment centre. And it was quite interesting because he made this statement about 2 to 3 years ago now. And he made the statement and everybody nodded at him and said, yes, Minister, and he hasn't stopped talking about it. Yeah, I was with him in Barcelona last week and the same thing. And what's interesting is that since that point, I went to meetings with him after, and there was little discussion on the detail of what wealth creation. He'd made the statement and everybody around him just was trying to ignore him on this point. And there was this subtle drift towards business as usual, yeah? Well, just try and paint what we do as usual as wealth creation. It was quite obvious they were painting this thing over here and then painting it another colour. And so we wanted to create the debate on that, and so there's a booklet in your folders where we put some ideas, and that's what I'm going to talk to you today about, some ideas around wealth creation. Because when anybody's talked about wealth creation in the public sector, but certainly about health, they jump straight to, you're going to sell my data. And we've seen the PR disaster that has actually happened over the last few weeks around getting that wrong, and that PR disaster, what happens in that. So here's some ideas. It's not about selling your data. So I'm going to give you some ideas. But there's a concept in the whole of this thing that you need to be really, really aware of, and it's something called looking good. And looking good is this. So here's a statement on diabetes. So I work with Aridhia, and I work with one of the world leaders in diabetes, Professor Andrew Morris. And I just went on the web and I took this definition of diabetes is a group of metabolic diseases characterized by hyperglycemia resulting from defects in insulin secretion, insulin action, or both. The chronic hyperglycemic of diabetes is associated with long-term damage, dysfunctional failure of all these kidneys, yeah? I know what every word is, but I actually don't understand it. But I'll possibly go into a meeting and be looking good and won't tell anybody I don't understand these words. And diabetes is a bad thing. My mother had it. My aunt died, of complications of diabetes. But I'll look good because I won't push the barriers because I'm doing that. And one of the interesting things in the healthcare systems, you have lots of people who've got to the top of their profession by being really good at the one thing they do. And they absolutely think they want to hold on to is looking good the whole time. Yeah. And when I put a statement up like open business models in a long-tail market and why executing on a consumer-grade biomedical informatics strategy is key, I understand all the words, I agree with you, Chris, or whatever, yeah? But do they really? And this is the question. You've got to challenge it and you've got to dive into it. Do they really know what that means? That's the conversation I'm going to have with you today. Myself and Kathy, who is a clinician, and Kim, who's Chief Privacy Officer, was the Chief Privacy Officer of Scotland. We put a paper together to discuss this. And from a business modelling point of view, it's about you're moving from an acute business model, yeah, to a wellness model. So an acute model, it's really interesting. Who are the doctors in the room? Hippocratic Oath? I assume you take one of those, didn't you? Yeah, you're going to help me get... Yeah. You can make that, but actually we pay a lot of, not necessarily here, but in a lot across the world, on actually me staying sicker. They get paid on having more treatment you do. That's a really interesting situation to put your profession in. So you've got this acute model, and then you're trying to bring in a new business model. So I look at it in the business terms, you're trying to transform to a wellness model. And people are trying to help you. So we've got Genomics England, we've got Transforming Your Care in Northern Ireland, we've got Horizon 2020, we've got the AHSNs, this is in Boston, they've got Bay State Innovation. And what they're stating in these things is that actually it's too difficult to to go in and fix the current model. So what we're going to do, we're going to use a technique by creating an innovation centre outside of it, working there and then trying to bring that back in. It's interesting because a lot of industries are doing the same thing at the moment. My own industry did it. We're on a change into this big data world, and we created a new company last year because we knew the company we'd built over the last 20 years was built on proprietary software, cost reduction initiatives, etc., etc., etc. We couldn't change the salespeople we bought. We couldn't change the technology people. We could try and change. It was too hard. So we said, we'll create a new company over here and do it over here, and then we'll look at the synergies across the two. So it's an interesting model, and I see the model of innovation centre taking place across the world. Now, whether you agree or disagree with it, it's happening because this is what's coming into place. What's interesting, I then did a little mini analysis and I listed down all the AHSN. I went through all the websites, and I had a look, and there were 4 key themes that were coming across the top of them. Everybody ticked the wealth creation because you don't get any money unless you tick that one, so I knew that one was in there. Everybody ticked collaboration because you don't do that one. Everybody ticked translational medicine, and lots of people ticked data. Always on this screen, you guys fall off the bottom, but you ticked everything along the bottom. Yeah, I think it was in this. So you've ticked everything along the bottom. And so the 4 key themes is this idea of translational medicine. How do we take the advances in genomic medicine, et cetera, and translate those back into clinical practice? People tell me the average at the moment is 19 years to get a piece of research into clinical practice. How do we shorten that down? Data and informatics was the key to everything. Collaboration was the key to everything. We hear it all the time. And the other big thing was wealth creation was the key to everything. So let's talk a little bit about this. How do, when you bring a technology in, whether whatever technology into a business. This is a classic business here where you've got your current, what you currently do from a technology point of view, and that could be anything. I've got my current business model that I'm delivering, and I bring some transformation in here, and as my business transformation takes place, I get a new business, and after time that becomes my new current, yeah, and that becomes my new technology, and then all you can do at the top of that peak up here is you can just optimize for more. You just optimize. That's all you can do. You're not doing. You can just optimize with the current system. And if you're ever in business, the one thing you will see: you can't cost cut your way to success. You can't optimize your way to success. You will find no CEO anywhere in the external business world who will actually talk to you about cost reduction. They will talk to you. They will send you off to their COO to talk about cost reduction. They will talk to you about how I'm growing the business and what new things am I doing. It's interesting because then you overlay the next world. So here's your old world, you're in acute medicine, you're really trying to make that more efficient, and then you want to put this wellness model on there. But you've got this legacy staying in existence, and you're trying to cope with this new change as well. And you're trying to do, you've got this triple challenge where Clay Peterson calls it the innovator's dilemma, where you've done this and you keep holding on to your old model at this point here without looking at it, and you eventually go out of business. Now my industry's in a once in a 30-year shift. We went from mainframes. Anybody old enough to remember mainframes here? Yeah, you don't look old enough. You all look young, and I do. I read about them in books now. I actually do read it. Mainframe, we went into the client server era, which is a technology in our era driven a lot by Microsoft, and then we're going into this new era of big data and cloud and mobile, etc. From the mainframe era to the client server era, there were 15 major companies in the mainframe era. Only one survived that transition, just to give you an idea how serious it is out there. Yeah, that was IBM, and they didn't survive as a mainframe company. They transformed themselves into services. So we are going through that same shift again. We're calling it third generation technology, and there's going to be lots of fallout in the technology world around who's going to make it. That's for a conversation outside of the public domain for who I want to tell you who I think is going to make it or not. So you've got this challenge here about doing this. I've got to carry on doing it, but do this thing. And the government are setting up these innovation centres. Governments around the world, you know, you see Genomics England set up outside. You're seeing, I'm saying, the AHSN, because it's such a difficult transition to make. So then if I look at it as a business modelling point of view, there's a great book around business modelling, Osterweld, a guy called Osterweld, Belgian guy, put this together, and you look at it, how to build your business model. If you want to build your business model, it's a great exercise to do. It's all open source. He says, here's your canvas that you need to do, and you've got to get these 9 things right. And they're fairly, if you work in business, there'd probably be a standard to clinical things that you would do. They seem fairly standard to me, but I can send you the links afterwards. These are the standards, you know, what are our customers, what are our customer relationships, how are we going to go to market, what revenue streams are we going to drive. Probably a lot of people in the NHS haven't been asked what revenue stream they're going to drive in the last few years. Yeah, you know, what are our key activities? You know, standard stuff we would see if we were building a business. And what they say is that these come out in some patterns, and there's about 5 standard patterns of business model we're seeing a lot at the moment. And 2 of those patterns, interestingly, the first one is the long tail business model, and this is a model that lots of people are driving. This is saying, actually, I can get more out of the long tail, the individual, if I can sell less to more than everything. So the example would be you go to the supermarket. I'm very peculiar, if anybody's met me, about the tea I drink. Yeah, I don't drink alcohol, but I drink tea. If I go to the supermarket, there's only like 5 types of tea on the supermarket shelf, and they're trying to sell the 5 types of tea to everybody. But if they can sell me my specific type of Assam tea that I like, I'll probably pay double for that cup of tea. Yeah. How do you get? And this is the Google model. This is the Netflix model. You go to the cinema, and there's only 5 films or 10 films at the Cineplex, but if you can get me my French art house movie that I might want to watch, yeah, I'll pay double for it on Netflix. How do you deal with the long tail? Because there's more money to be made in that long tail than there is in there. Now this is absolutely tailor-made for personalised medicine, because if you map the genome, you are moving into a long tail market. That's what you're moving into. You want to get personalised medicine for the individual, yeah, and also at a population level to do the analysis both at the same time. You are absolutely moving into a long tail market. So as you know, looking at your wealth creation, you need to think, right, I'm moving into a long tail market. That's the market we're going into. The other market you're going into, because it's a hybrid model, I think, is this open business model market around systematic collaboration. And the reason I say that is because you talk a lot about collaboration. And lots of this has been driven, the life science people, the pharmaceutical companies are trying to drive this quite a bit at the moment around. So systematic collaboration, because everybody said they wanted to collaborate. How do you design it systematically into you? And I'll give you an example where systematic collaboration, and you mentioned it earlier, I think, about the speech yesterday, you're disconnecting for health. Now, I've been in the healthcare system for the last, or working with you for the last 2 years, I call it disconnecting for health, was driven by less than systematic collaboration. It was driven by a number of IT companies who wanted to make more of their fair share of the profit than actually everybody make money out of it, or wealth, or whatever it is. So you ended up in a model where they weren't systematically collaborating, they were systematically doing something else, and I won't use the word, yeah, but you were ending up in a different model. So if you can build a business model that systematically collaborates and drives the long-tail business model, yeah, this is my logic to why you need to focus on those two areas, yeah. So let's look at that a bit better. So when I do mapping, and this is straight out the book, when I look at the mapping of, these are a couple of examples in the book of when I look at the businesses of how you drive those businesses, both of them have the same pattern here at the what are the key resources, and it's all about building the right platform and driving and content and people to your platform. Now that platform, don't think of it as just a technology platform. That platform could be the region, the AHSN. You know, how do you drive people here? How do you drive content here? How do you, and think of yourself as a platform, the area as a business platform. And most people, when I go into it, and I've looked at their models through my work with the ECH Alliance, is they're looking at their region and then they go straight to the, all right, I've got to optimize my current region and what I do in there, etc., etc. They're not driving anything new, they just stay looking in their region. And they all seem to have missed the point of actually what you've also got to do is drive people to it. And actually, it's people outside of the country would even be better, yeah? And how do you drive people to it? So let's look at some of the real brilliant people at doing this who've been the early adopters of actually long-tail business models and collaborative. And these are the internet giants. And you use them every day in your day-to-day life. I'm sure most people here are on LinkedIn or use PayPal. Everybody's probably a customer of Amazon and Google. These are the experts. So what is it they've done really well in this place? So the first thing they did is they built something called consumer-grade IT, and they built it really well. Now, there's a difference, because at the top of that model where we were optimizing, there was the IT world was in enterprise grade is the best. Enterprise grade is the best. And what they did is said, that doesn't suit the model that we want to work with. It doesn't scale, it's not big enough, it can't act at pace. Scale and pace, two things you mentioned, Liz. And it doesn't allow collaboration. It's built on proprietary software. It doesn't give us an open model where we can go, listen, we are going to build IT differently. Because what they didn't have the acute model, the legacy model holding them back. They said, we can do greenfield site. So what are we doing greenfield site? So one of the things they all do well, and if you look at them all, they can all reason really well over very, very large data sets. That's what they build their business models on, which is what this whole collaborative is about. And they call that data science. I don't know if that's a term used a lot in the healthcare, but biomedical informatics might be more, but you know, being able to look at the data and look at patterns in data. The other thing they did, they took a totally different approach to how they capture the data. Lots of people talk about optimizing their current system, and you need your current systems, your PAC systems and all those things working in Wi-Fi. But they took the approach of, I'm going to build a data lake or a data landing zone or a data ocean, and I'm going to build that, and then I'm going to build the model I need when I need it. I'm not going to try and build one model to do everything, because actually people have tried it before and it just doesn't work, and they're unscalable and you can't use them at pace. So what we're going to do, so Walmart have standardized this, the New York Stock Exchange has standardized on this approach, GE have standardized this approach. How do we just build this big data lake and then build the applications we want in real time on the top of that thing? And it's slightly different, because what you've got at the moment is lots of people trying to extend their old model and say this will work in the new world, but actually the new guys are not going to work. So I've highlighted in red, in your world the language will probably be safe haven. You hear people talk about clinical safe havens, research safe havens, or wherever you put your data into, whatever. The other thing they did, they built applications in a new way. If you want to optimize your application build, what you did for the last 30 years, you offshored it to China or India or somewhere. They said that doesn't work for us, because that puts us in a contract model, which is I've got to define everything I know about what I want to do in 2 years' time. I'm going to write a contract with you, and then you're going to charge me for change requests for the next 10 years of my life, and actually I'm not going to get delivered anything I knew. So the shift of how you're working is to what we call an agile method. So the first people who can bring agile methodology into this is, you know, first AHSN is going to be really good. How do I move from I've got to write everything down that I'm going to deliver in the next 10 years, which is what happened on Disconnecting for Health, but actually work in an agile method? But if you're there to keep thousands of people busy, you don't want to work in an agile method, because it's too hard on your business model to say, how am I going to keep them all busy? So this shift at the moment, which is what our industry is going through, to agile methods and how you use agile methods to deliver big data, is an interesting one, which is why you're getting all the small little companies coming up and the bigger companies struggling in how they're doing this. It's very interesting. So this shift, they developed applications differently. They developed them in different frameworks. They developed them out of the cloud, and they didn't care what physical infrastructure they were built on. That's interesting for a business of mine that made a fortune on building physical infrastructure. Yeah, so we said, fine, let that business carry on. We'll build another business that's focused on this. Because why am I going to try and paint this thing over here blue when it isn't? You'll soon see through it. Other couple of things that are quite important that I would draw your attention to is trust. And as you've known, you've seen the PR disaster we've had lately in the care.data thing, yeah. But it's a subtle thing. People give you trust, you can't buy it off people, yeah. And unless you are trusted, now this actually is the biggest positive UK PLC has, and we don't leverage it enough. We're a very trusted nation. We've got fantastic history of using standards. I imagine lots of people copy the NICE standard throughout the world, for sure, the Commonwealth countries, I imagine. We've got the BS organisation, which is the British Standards Organisation. Lots of people copy that. We've got, we probably drive most of ISO. We've got a really good, we've actually also got a unique legal system here in the UK. Yeah, we're the only one who does, we're only one of 3 countries in the world that doesn't have an actual what do they call it? The amendments thing, the Fifth Amendment, the Constitution. Yeah. America's always getting fallen by its Constitution. We can move quite rapidly, and we take people to court, and we've got a real. Yeah, if anyone outside looking at us, we complain about them, and it's a massive PR for us if we can say. We can build on all the trusted establishments, NHS, all the work you do, you can build on that as a positive. Everybody look, when I go around the ECH Alliance to the other countries, they all think that NHS is wonderful. They cannot wonder why we beat the hell out of it every time we get in our newspapers. And I'm looking at them saying, I agree with you, I don't know what's going on here. So it's a massive benefit you can have, and using UK PLC as trust as a weapon to actually sell out there. Huge part. So think about that, I would say. You trust, we are a trusted country. You wouldn't trust about putting your data or giving your data science to, a West African province where most viruses come out of or something, yeah, or even Russia or even China. But you would come to here, and we're in a time zone between China and America, massive data hub. We even look like a data hub on the map of the world if you look at it, yeah? We actually look like a data hub, yeah? We've got great connections in and stuff like that. Data embassies will be well away. So trust is another, and the other one, brand. And this is another great thing. Brand UK is brilliant. The Olympics did a great job for us, actually. Brilliant job. NHS, fantastic brand, yeah, outside in the world. You've got to realise people are attracted. When I'm in a trust thing, I give things to a brand. If you mess up, you can kill your whole business, but people will give you stuff. So brand becomes really important, and I look at the AHSN and say, where's your marketing person? Yeah, think of the massive disaster we've just had last week, yeah, and I look at all the appointments and I say, yeah, where's the marketing team on that? Where are you driving brand and driving that out there as well? So it's an interesting thing to look at. So how would you actually make money out of this thing? Well, if you look at the kind of revenue streams, if I just looked at it from a data perspective, I could offer out research safe havens for collaborative Horizon 2020 bids. Everybody, you've got to draw up. Usually what you end up is one of the universities saying we'll do it, and it actually never does properly because it's not in an actual proper hosted system, but you could actually offer that out. You could offer the linking of data sets, you could offer clinical EDL, you could offer visualization schools. If I went to the knowledge area, you could start offering model building or standards definition or education, yeah, as service. If I went to the clinical end, you could say, well, I've done a bit of analysis for you. We've worked out these people over here are really seriously going to be affected in their future life. But actually, you as a country don't have any clinical skills, counselling skills. Why don't we supply you with the counselling skills as well? And you're starting creating wealth from that. You could start doing risk stratification for people, cohort selection. There's a whole different way of looking at what you could sell at different layers and creating wealth. None of it's about selling the data. To give you a couple of real examples and to lead nicely into Karen as well, is the first one is Aridhia. Aridhia, we came across them, they build their technologies on our platform. They're a company, about 85 people of data scientists, clinicians, developers who focus on building what started off focusing both clinical apps, but Karen will introduce them more. But they're 85 people doing that in Scotland, in Edinburgh, and creating those 85 jobs immediately. What was really interesting, one of the first projects they did was taking their diabetes skills that Liz mentioned and taking them to Kuwait. Now this is great, selling them to the Kuwaiti government and doing projects there, etc., working that. But then what they did, it's really clever, they said, actually, you know what, you need to train your clinicians and all your medical staff in this as well. So what we'll do, we'll go back to the Dundee University and we'll create a master's for you to go and do that. I don't know, about 200 or 300 people have already been through the masters. And I went to the Dasmond Institute website before I left, whenever I sent you this on Sunday night or something, didn't I? Yes, I went the latest I could on Saturday night when I was putting this together. And there on the front of their website is, we welcome applications to enroll on the Dundee Diabetes course. Immediately continue driving revenue back to the country. Really interesting way. That's driving revenue in a different way than most people think it's about selling your data. So if they get, I don't know, what do we charge for a PhD or a master's at the moment? I don't know, externally. 20 grand, yeah? Imagine getting a couple of hundred of those in. And you know what you've done? You've created the links to that region. So where do those people through the rest of their career all link back to? Back to your region. Where do they all come back to? Back to your region for help. Really fascinating way about doing it. But they didn't stop there, and Karen will talk more about this. They then said, well, the next evolution isn't about just doing that. It's about looking at all this new data and getting all these new data types together and working everybody in collaboration. And they put something together called Stratified Medicine Scotland, which is across all the universities, all the hospitals. Karen's going to dig into deeper to that for you around creating jobs and money over the next few years and making everybody work together with about 20 SMEs, but she'll talk to you more about that. What's interesting, they haven't stopped there and they're even moving towards that. So we're doing all this new stuff on this new data and looking at new technologies, cloud-based, mobile-based technologies. How can we take that learning back into that acute setting and actually make that work for us? And hopefully she'll talk a little bit about the new target operating model that they're building, about supplying things like diabetes and readmissions out of a more cloud-based big data model, yeah, at a dramatically reduced cost. So you don't have to spend all your time, so your key people can focus on what they're doing and not being sort of infrastructure builders, and take the model they used to do really well in the clinicians that they gave, the clinical analytics that they gave to QA, the new stuff they're doing around the real data, and say actually best way to innovate is put two things you already do together, yeah, and put those together and then serve those back out. So